So hi everyone and welcome to our fourth lecture in this Wolfson Centre lecture series. My name is Lucy Riglin. I'm a lecturer here at the Wolfson Centre and I'm going to be introducing our speaker today. Just a few things to note first. So one is that this is a public lecture, so it's being recorded and it's going to be posted on YouTube, where you'll also be able to see any other talks in this series that you may have missed. Please make sure that you're signed up to the Wolfson mailing list if you'd like to be kept informed about these and other upcoming Wolfson events. And finally, just a reminder really that this session is scheduled for an hour and that questions and discussion are really encouraged. And please post your questions via the Q&A box, which you should be able to see at the bottom of your Zoom screen. So now it's my pleasure to introduce our speaker today, Professor Katherine Shelton, who is a Professor of Developmental Psychology in the School of Psychology here at Cardiff University and is a member of the Cascade Partnership, the Children's Social Care Research and Development Centre. Professor Shelton's work focuses on the emergence and maintenance of developmental psychopathology in social contexts during childhood and adolescence, and particularly the relationship between aspects of family functioning and children's psychological well-being. And I'm sure that her talk today on the mental health and neuropsychological profile of children adopted from care, support needs in the context of family life, will be of great interest to those of us interested in understanding and improving young people's mental health. And we thank her very much for coming and speaking with us today. So without further ado, over to you, Katherine.
Thank you. Good afternoon, everyone, and thank you for taking the time to attend this talk. So as Lucy said, I'm going to be talking about the mental health and neuropsychological profile of children adopted from care. And then I'm going to be thinking about what that means for adoptive families in terms of their support needs, particularly in the early years after placement. I just want to begin rather than end with acknowledgements while you're all here and still conscious. So my primary acknowledgement is to the families who have participated in the studies I'm going to present to you today. I'm very grateful to them for their time and commitment to our work. I also want to thank our funders and our advisory group. And then last but not least, I really want to reflect that this has been a multidisciplinary team effort with contributions from law and politics, from the social sciences, and indeed from psychologists. So I'm hugely grateful to the team who've been involved in this programme of research over the past 6 or so years. And everything I present today is really because of their endeavours, quite frankly. My focus today is to think about adoption through a psychological lens, and that's going to be my real area of focus with you. So to begin with, I want to give you some background to this area of work and a flavour for what we know already. I then want to describe the Wales Adoption Cohort Study, which forms the basis for our findings. So I'll just give you a feel for the research design and where the information has come from that I then build on as part of presenting the results. So as part of those results, then I wanted to show you what we found around children's mental health and also the neurocognitive profile, but then go from there to think about what the implications of that profile are for family life, including aspects of employment. And then move from there then about what those impacts are to looking at family functioning and the role of parent behaviour, and really thinking about, does it matter for children the ways in which adoptive parents behave, and if so, what matters, when and why. And then I'll turn to just introducing you to the sorts of things we're looking at going into the autumn of this year and then spring 2023, just to think about next steps. So for those of you not familiar, in England and Wales, most adoptions are of children in state care because of abuse or neglect, or when the children have been removed at birth because of unresolved concerns about the risk of significant harm. During the care proceedings that will have led to the placement order for adoption being made, it's important to stress that a range of other long-term options will have been considered by social workers and other experts, including the possible safe return to parents, placement with a member of the extended family, as well as long-term foster care. And these decisions are made in accordance with the principle that the child's welfare is paramount. And for those interested in this sphere of family law, I would refer you to the work of Julie Doughty, who's my colleague in the School of Law and Politics. So children placed for adoption, you can imagine, come from often chaotic environments that have been characterised by what psychologists would refer to instability and disorder. And this may include any of these features. So prenatal adversity, including substance abuse, maternal stress or poor nutrition, difficult or abusive family relationships, moves into and within care in the earliest years of life, and also then coping with the loss of family, friends, and indeed possessions. So if you take that in the whole, you can think how that stands in quite stark contrast to most of our experiences of our earliest years of life. That said, adoption as an intervention greatly improves developmental outcomes of vulnerable children. This is relatively well established in the international literature. However, adopted children are more likely to experience enduring psychological and behavioural difficulties across their development. But there is a surprising knowledge gap about how children adopted from care in the UK fare, and in particular what psychological processes, intrapersonal and interpersonal, are relevant to understanding child development after adoption. And that was the key motivation, really, for the Wales Adoption Cohort Study. So what I want to do now is move to just a brief description to give you a feel for that study so that you can make sense of the findings that then follow. Our interdisciplinary team were funded for about 2 years to send questionnaires to adoptive parents on 2 occasions, separated by about a year. When we first approached parents, they were at about 5 months after placement, so the child had been living with those families for about 20 weeks. And 96 parents returned questionnaires to us. That's this second soft rectangle here on this screen. We then recruited a subsample of those parents to whom we went to their homes. So we went to about 40 homes for about 2 to 3 hours and conducted very in-depth interviews with those families. And then we went on about 21 months after placement to conduct another questionnaire. All of this information then was complemented by the research team going out to local authority offices and extracting information from social work records about the children's biographical character features and experiences, including aspects of early adversity, reasons for coming into care and the like. And we were very fortunate to be able to extract information for all children who were placed between summer 2014 and summer 2015. So we have a really good profile of that group of Welsh children. We were also fortunate that Welsh Government gave us follow-up funding that enabled us to conduct further questionnaire mail-outs at 3 years, 4 years and 5 years after placement, ending just before the pandemic. So we have actually, for many of our families, about 5 waves of information about them to see how things have developed over time for them as parents. So that gives you a flavour for where the information is coming from that I'm going to be talking about today. So just to introduce the families a little bit and give you a pen portrait of them, the 96 families in our study were caring for about 128 children, and that's because families sometimes adopt sibling groups of 2 or 3 children. But we always asked our parents to just comment on the eldest child that they had adopted at that time. So about half of the children were boys, and they ranged in age at placement. So about a quarter were adopted as infants, so less than 12 months old. 44% were between 1 and 4 years old, and 31% were over 4 and therefore they were on the cusp or had started school. Most of the children, so 70%, have been placed individually, while the remainder were placed as a sibling group, as I've said. But it's really important to note that for those individuals, the vast majority will have siblings living elsewhere in other care arrangements, either with their birth families, or they've been adopted, or they're in long-term foster care. You've probably jumped ahead of me in reading the slides, so you know that most of our responses have come from mums, but we do also have some fathers responding, and 2% didn't specify. And then most are couples, and then a proportion are single adopters, which is fantastic to have their perspective on their experiences as well. To give you a feel for what the children had experienced before they were placed for adoption, on average, the children had spent over just under a year and a half with their birth parents, but there was considerable range around that average. And again, then on average, they'd spent a year and a half in care before they'd been placed for adoption. And they'd also had, on average, 1 move between households within care. And again, that range was quite significant. And then I'll come back to this, but just to note that from the social work records, we know that about, on average, the children who experienced 2 adverse life experiences before they'd been placed. Okay, so let's get into looking at the mental health and neurocognitive profile of the children. So what I've already alluded to is that we don't really understand the specific effects of risk factors on children's mental health after placement. These have not been well studied or indeed understood. So one of our initial questions was to establish whether early adversity is associated with a greater risk for enduring emotional and behavioural problems over a 4-year period after placement. How did we measure early adversity? Well, we actually used a principal component approach whereby we ended up taking 3 main indices to index early adversity. The first was the child's age at placement in years, because we know that the longer it's taken for children to be placed for adoption, the more exposure they've probably had to adversity in one way, shape or form. We also used the number of days in care. And then we also used a cumulative score of the number of adverse life experiences, which of course is not without its controversy as a measurement approach, but we used 10 categories from these social work records, including child abuse or maltreatment, neglect, and household dysfunction. And each category was coded as either absent or present, and that resulted in a score for each child from 10. What's at least mitigates some of the problems with this approach is that we were relying on social work records, where social workers are required to be extremely accurate and careful in their recording of biographical information. So it's less vulnerable to the effects of retrospective recall. Okay, so then looking at children's mental health, for the work I'm going to be mostly focused on today, we used the child behaviour checklist, but we also had the strength and difficulties questionnaire. So the child behaviour checklist we used to provide us with an index of child's emotional symptoms or internalising problems, and also their behavioural problems or externalising difficulties. And for those of you who are interested, you know, a notable proportion of the children between 11 and just under 18% could be categorised as being in the clinical range for externalising problems, and similarly, just under 20% with internalising symptoms are in the clinical range. But I'm not going to be using those cut-offs today. I'm going to be thinking about all of the children across a continuum of difficulty. Okay, so that gives us, you know, we're using these standardised measures of children's mental health problems. But I just wanted to take advantage of the fact that parents actually took the time to comment in their questionnaires about what they're experiencing in relation to children's behaviour. So I just wanted to share that with you momentarily. So even at 20 weeks and maybe a year into placement, parents were describing some difficult behaviours, including defiance, challenging behaviour, not caring if they hurt you when they pinched you. One parent commented, very early on in the placement that they'd had a really difficult Christmas with the children's disruptive behaviour and come back and felt like they weren't making really any headway at all. So it's not just in their standardised kind of responses to these scales, it's also in their own narratives, really, parents' comments about difficulties. So what does that look like then when we chart it across time? So focusing on parents' reports of children's emotional and behavioural problems, we were charting patterns of change in the adopted children's outcomes as a function of their age. And we found non-linear trajectories of change over time. As you can see, these are not inexorably going upward in symptom scores. Rather, what we observe for internalizing symptoms on the left-hand side of this chart is that children displayed an accelerated increase of internalizing that leveled off just before and during the transition to school. And that was actually mirrored then in the externalizing problem scores in the right-hand side. So it increases and then it levels up, and then there's some evidence that it starts to come down. Now, that pattern of change across this developmental period is actually really in line with numerous population studies. This is not particularly surprising and is what you would expect in the general population. What we then did was add in a control or an estimate of pre-adoptive adversity according to that risk index that I just showed to you. And we found that higher risk scores were associated with higher initial emotional problem scores, as shown by this left-hand panel with the red line. Furthermore, pre-adoptive risk was associated with differences in the rate of change of emotional problems over time, those internalizing symptoms. So we found that children who had experienced less pre-adoptive adversity, as shown by this dashed blue line, were more likely to have a de-escalation of emotional problems across childhood. In contrast, children exposed to higher levels of risk before placement, in this red line, did not show that same rate of decrease in their internalizing symptoms. Turning then to the externalizing problems chart, it's not quite so clear. And actually, the higher risk group did have higher initial scores for externalizing problems, but the differences in trajectories were not significant. So where there's something apparently of interest, it's around this internalizing symptoms profile. So an interim conclusion at this moment, for us at least, was that knowledge about a child's early experiences could be a powerful tool for identifying children at risk for enduring mental health problems. And that could have implications for the planning and provision of adoption support well after placement. So not just in the first few weeks after the child has moved in with their family, but across the many months and years that follow. So that nuanced detailed profile is potentially invaluable. What I want to do now is look at how we're going to develop knowledge of children's affective and cognitive development, because this also has the potential to reveal targets for intervention for families and perhaps also in the school context. And we're grateful to the Waterloo Foundation for the funding that actually enabled this project to take place. So again, thinking about what parents themselves said, this was apparent in their early comments about what was happening in relation to their children's development soon after placement. So more than a third of parents identified concerns about their child's development very early on that were not to do with mental health, but were to do with other aspects of child development. So many parents simply recorded developmental delay, but more than a quarter specifically mentioned concerns about their child's speech and language development. So, for example, one mother commented, she's not speaking yet, she's only saying a few words, and she's 2 years old. Now, it's possible, entirely possible, and parents were well aware of this, that the difficulties that they were experiencing or observing were exacerbated by the child's move to the adoptive family home and the loss of a previous primary carer, such as the foster carer. So parents were often worried about whether the difficulties they're observing were adoption related and what they could consider to be normal versus of more concern in relation to their child's presentation. So we were really fortunate that we were able to take advantage and work with the Neurodevelopment Assessment Unit here in the School of Psychology at Cardiff. And this is a programme of work that's directed by Professor Stephanie van Oosen, and again funded by the Waterloo Foundation. And as I'm talking, if you're interested, you could put this title into YouTube and it will tell you a lot more about the work of the unit. Because I'm sure many of you will be interested. But the primary aim of the unit is to collect broad assessment data on primary school aged children aged 4 to 7 years old with diverse developmental problems. And through referrals by teachers, we're aiming to understand the overlapping cognitive and socio-emotional bases of different profiles of children with neurodevelopmental problems. So we brought in a group of children who had been adopted and who were within the age range that we were able to assess them, so 4 to 7 years old. And they'd been placed for adoption on average at about 2 years old. So again, we examined their emotional and behavioural problems at home, but also now at school with teacher reports. And we profiled their performance on a range of neurocognitive tasks, including attention, memory, non-verbal reasoning, and facial emotion recognition. And we found a somewhat counterintuitive pattern of results. So in fact, contrary to our hypotheses, on average, the children performed within the expected range across all the neurocognitive abilities we examined, bearing in mind that the children came to the unit on 2 separate occasions for 3 hours in duration. So we had a huge amount of information from the families. However, as hypothesized, the children did have more emotional and behavior problems than we would observe in the general population. And also, at least 1 in 5 of the children, a significant minority, scored below the expected range for their age across a range of tasks, including cognitive flexibility, episodic memory, and non-verbal reasoning. Moreover, children who scored lower on non-verbal reasoning tasks were more likely to have parent and teacher rated behavioural problems, and children's performance on the inhibitory control and cognitive flexibility tasks were associated with parent-rated behavioural problems. So there was some overlap here between the neurocognitive profile of a notable number of the children and what teachers were observing and parents were observing about their behaviour at home and at school. We also found that children who were older at the time of their adoptive placement had lower non-verbal reasoning scores, indicating that this may be a particular area of need for children who may have experienced a greater accumulation of pre-placement risk factors. So it's a potential target for where adoptive parents might work with school teachers to create a classroom environment and a way of working with children that can address that potential challenge around non-verbal reasoning. Okay, so that's the profile. What does it mean and does it matter for families? And that was something that we really wanted to bear down on as a question, because we can assume all sorts of things about impact, but it was important for us to actually test that as an objective way as possible. Again, just returning to the voice of parents. Parents are conscious of impacts of children's mental health and well-being on family life. So this mother commented very early on, "The nursery are concerned and close to excluding the child due to daily events. I've been looking for an alternative job with less hours." Likewise, another parent, "It would be better if there was financial support so I could work part-time. The child would benefit from more time with us and I'd get more time to recoup and stay fit." So we really wanted to understand whether there were practical implications of this profile for family life. So first of all, we wanted to test out whether there was a relationship between child characteristics and a change in finances and employment in the 5 years after adoption. The way we did this was to use all 5 waves of questionnaire data and use time series analysis to examine the impact of child, family structure and parent mental health on a change in household income and employment after adoption. We also used a count of parents' comments about employment and finances and the emotional valence of their comments across the questionnaires, across all waves of questionnaires, to gauge their concern about their circumstances. So we used a sentiment analysis to do this. So it was taking advantage of what they'd written, as well as the standardized scores that we had across a range of measures to bear down on this question. I think it's quite important because there's an assumption that adoptive families are affluent and able to possibly buy ways out of difficulty, and that is simply not the case with the profile of families who adopted Welsh children in this study by any stretch of the imagination. So looking at our findings then, unsurprisingly but importantly, being in a relationship was associated with higher household income over time, and with the primary caregiver being less likely to be in full-time work. So having that higher income affords the capacity perhaps for less intense working or different patterns of working in those dual income families. So it could be that it's facilitative of one parent spending less time in employment. But it's important to note, though, that we also found that being in full-time work was associated with parental anxiety, and also that adoption is meant to be inclusive of adults from all walks of life, not just dual income families, and that single adults are actively encouraged to consider adoption. So this is a really important finding, even though it may just feel like common sense. So looking at in more detail at the results, children's behaviour and emotional problems were associated with primary caregivers reducing the time spent in employment, and with parents' tendency to comment on their financial and work circumstances. So there's something about the children's profile of mental health that's leading to a reduction over that 5-year time period in employment. It's also the case that children who experienced more moves in care, such as between foster carers, they were more likely to have a primary caregiver who was not in full-time work. Just to give a little bit more detail then in relation to the behavioural and emotional problem profile, the children's emotional problems were associated with more comments in terms of volume about employment and work patterns, whereas behavioural problems were associated with more negative comments in terms of the valence of those comments. And we think maybe that the issue around moves in care could be parents seeking to increase their efforts to provide their children with elevated stability in those early years of being at primary school to meet that child's needs more intensively. But that's inferring direction of effect here. So what this suggests is that there is a relationship between children's mental health and how families organise their lives with respect to their work. And that feels to me really important. But building on that then, we really need to drill down into whether the nature of the time spent with children by parents has implications for their mental health. So this is telling something about family structure, and that it feels like it might be a response to the children's needs. What then does that mean, or what does it look like when you look at the quality of family relationships as these unfold across this time period?
Hey, new skates. Hey, thanks, Minnie. Mickey said with a big grin. Mickey strapped on his shiny new skates. Come on, everybody. Speak off.
He's a little dude. So what I'm showing in this video is what we went on to look at in really quite considerable detail, and that is parental warmth. So does parent behaviour, and in particular the construct of expressions of warmth and affection from the parent to the child, make a difference to the adoptive children's mental health? So I'll just replay this man reading his child a story, and it's about Mickey Mouse. If I can just move the Zoom button a minute.
Hey, new skates. Hey, thanks, Minnie. Mickey said with a big grin. Mickey stepped on his shiny new skates. Come on, everybody. He called.
Okay, so why are we interested in parental warmth? Well, as I said to you at the start, adoptees may be at greater risk for developmental difficulties, and certainly some of our data suggests that they are. But the majority of adopted children are actually really well adjusted and thriving, despite some possible difficulties in some key domains. Why? Well, there's some evidence that warm parenting may buffer or mitigate the impact of early adversity on adoptees' outcomes. And we wanted to test this in this Welsh sample. So we first of all began by looking at parents-child warmth as parents report it in questionnaires. So we used frequency of expressions of warmth in the past month. And these are derived from a 6-item measure from the Iowa Youth and Families Project. So sample items include acts loving and affectionate towards them. How often do you tell them that you love them? So parents fill this in, and each questionnaire we ask them to fill the same measure in again, and we use that then to see if it might offset the effects of early adversity on poor outcomes. And this is what we found. So in our investigation of parental warmth, we found that parent reports of warmth towards their child had a marked effect on both children's emotional and behavioural problems over time. So again, on the left-hand panel, you've got internalising symptoms, and on the right-hand panel, externalising problems. And the red line is where parents were very high in parental warmth, and the blue dashed line indicates lower parental warmth. And here you can see from the red lines that children of adopted parents who reported very high warmth towards their child consistently showed fewer emotional and behaviour problems over time. And this suggests that fostering exceptionally warm parenting through interventions could be a valuable way to promote positive outcomes for adopted children. So that's really exciting. However, it's caveated by the fact that we did not find that parental warmth significantly attenuated the impact of early adversity on adopted children's mental health. So that means that it's possible that we were not powered to detect that effect if it was there, because our findings were in line with the expected pattern that parental warmth was protected. It's just that it did not attain significance. But these in and on themselves, with or without the thinking about whether or not they moderate the effects of early adversity, are encouraging, because they suggest that where you have this high level of parental warmth, it's to the benefit of children's mental health over time. Some of you may be thinking, well, what about the opposite scenario, whereby children evoke responses in parents? Now, we actually found no conclusive evidence that children's emotional and behavioural problems at 5 months post-placement influenced adoptive parents' reports of warmth at 21 months after placement. But that's something we want to come back to with additional analyses. We want to really go back and think carefully about the role of children in influencing how family life unfolds in those first 5 years after adoption. Okay. So we have these parent reports of warmth, and perhaps not surprisingly, the parents who completed questionnaires rated themselves very highly in their expressions of warmth towards their child. This is not surprising, partly notwithstanding response biases, but also because parents are so extensively screened and assessed on precisely these types of constructs to ensure they are capable of expressing very high levels of warmth. But we wanted to drill down a little bit more into the nuance of this and understand it a bit more. So we actually went back to the Neurodevelopment Assessment Unit data, and we used a 5-minute speech sample whereby parents are asked to speak about their child freely for 5 minutes. And if you've tried to do this about someone you love, you'll find it incredibly hard to speak for 5 minutes about them. So what we're actually interested in doing then is coding these 5-minute speech samples in 2 ways. So the parent is asked, could you just tell me a little bit more about Sally, what she's like, and I'm going to not interrupt you for 5 minutes, and then it's over to the parent. Now that 5-minute sample is then coded for expressions of warmth, but also for their tone of voice. What we were then interested in moving a little bit away from these global indices of internalising and externalising was to look at whether those expressions of warmth are associated with the child's capability to recognise emotions, to discriminate between different emotions accurately, and also to check whether there's an association with their response biases. So perceiving a face as angry when it is in fact neutral. Okay, so what did we find? We found that this warm adoptive parenting, as coded used by independent objective observers, we found that our coding of that warm adoptive parenting from that 5-minute speech sample was associated with fewer behavioural problems in children, and also a lower tendency for children to incorrectly identify non-angry faces as angry. Now that's consistent with warm parenting being associated with a lower tendency in children to exhibit a hostile bias in their emotion recognition. Now that's really exciting because we know that these difficulties with emotion recognition and discrimination may actually be vulnerability factors for conduct problems or other difficulties in school with peers and the like. So if warm parenting is in fact implicated in that process, then it could be that it's part of a profile, a constellation of parenting behaviours that foster emotional competence in children, and in this instance, children that we would regard as being potentially vulnerable. So where we want to go next with that, because we really want to assist and help refine current therapeutic approaches to supporting adoptive families. Number one, we want to look at the global ratings of parent-child interactions, such as positive and negative parenting. We want to look at fine-grained coding of emotional states, such as parents' use of smiles and laughter with their children, and then also elements of their speech with their children, such as mental state language. So speaking to your child and recognizing them as other. So what do you think we should do next? And we're doing this using a problem-solving task with an Etch-a-Sketch toy. So we've brought children into the neurodevelopment assessment unit, and mum or parent complete an Etch-a-Sketch drawing with their child. And we observe them for 5 minutes doing this task, and then we code it. And some of our initial findings, we're going into the autumn with this, suggest that that very nuanced way of interacting with children could have some real insights for us in terms of how you foster and build strong parent-child interactions that may enable children to thrive. We're mindful, of course, that there are no off-the-shelf, one-size-fits-all answers for thinking about the legacy of early maltreatment and neglect. And that's in the words of Matt Walgar and John Simmons. So parenting is just one possible opportunity, and we're by no means suggesting that all of the onus for supporting adopted children rests with parents alone. It's going to take a team effort to support children after adoption, particularly those who have been exposed to high-risk environments before placement. Okay, so I've said all this, and one thing I did want to leave you with was a couple of thoughts, which is that it's very easy to over-pathologize children. And I really want to emphasize that there's considerable heterogeneity in adopted children's needs after placement. Well, that was my conclusions, but I'll come back to that. So first of all, just before the pandemic, when we did our last questionnaire, we asked parents, how is your child faring overall? And the majority said that the placement was going really well. Family life was going really well. 21% said they were just managing, which is obviously concerning. And 5% said they were struggling to manage. But no parent said it's possible that my or our child won't remain in this family and return to long-term care. There have been disruptions, and these happened quite early on in placement, where the child returned to foster care and the adoption did not proceed. But they're a minority of this sample. Likewise, I wanted to leave you with the voice of parents. So no one can prepare someone for what it is like to adopt a child. It's completely changed my life for the better. Sometimes I feel exhausted and feel that I can't do it alone, but the next morning I'm ready to carry on. Likewise, life is absolutely wonderful with our daughter in it. She's kind, funny, loving, thriving, developing and learning. She's just amazing. And then finally, which I really like, the children are energetic and loving, and we have a strong family dynamic of mayhem. So that's what I wanted to leave you with, is just to slightly offset the sense that there's considerable challenge here. There's a lot that we need to do to support adoptive families after placement, but that's not to say that their lives are not really thriving and they're loving being together in their families. Okay, so I think I'll stop there and take any questions or have a discussion as you all see fit. So thank you very much.
Okay, well, as Catherine said, thank you very much everyone for coming, and thank you, Catherine, ever so much for that excellent talk and for really interesting points and discussions afterwards. See you all again soon, hopefully.